Well, in Pennsylvania, nurse practitioners have been pushing for full practice authority for many years.
All right, now our Pennsylvania State Capitol correspondent Brendan Scanlon spoke with some of those nurses, and he joins us live with details. Brendan, what is full practice authority, and why are nurse practitioners advocating for it?
Hey there, Renata and Nick. Good evening. Well, currently, nurse practitioners are required to practice under a collaboration agreement with a physician here in the Commonwealth. Nurses say one of the best ways to explain it is like kind of being stuck with a permanent student driver's permit. Except instead of a licensed driver in the passenger seat for a temporary amount of time, it's a physician essentially overseeing how a nurse practices at all times.
I don't need somebody sitting in my front seat telling me what I need to do anymore.
Pennsylvania nurse practitioners are looking to cure what they call an antiquated law.
Currently, we have to have 2 collaborative agreements, 2 legal documents to practice to the full extent of our education and training, which are cumbersome.
Nurse practitioners like Cheryl Schlam say it limits their ability to care for patients, especially in underserved communities experiencing a primary care shortage.
80% of us do primary care, and sometimes in areas where you can't really get access to care, whether that be rural and sometimes inner city areas.
Let's get these 18,000 nurse practitioners in Pennsylvania up and ready to do what they do best.
Senator Camera Bartolotta is the sponsor of Senate Bill 25, which would give full practice authority to nurse practitioners. 27 other states already granted, including many of Pennsylvania's neighbors.
Right now, we see a huge decline in our highly qualified nurses. They're moving to other states, especially other states that are around Pennsylvania. They border us and they offer full practice authority.
The bill would require a 3-year, 3,600-hour collaboration agreement with a physician before nurse practitioners can work independently. But some physicians say there's no need to fix the current system if it isn't broken.
A lot of the current models that we have for care work.
Pennsylvania Medical Society President Dr. F. Wilson Jackson believes patients benefit from collaboration with a physician.
What we have concerns over is the independent authority that they're seeking. We feel that patients' care is optimized when there's a physician as part of that care team.
And now nurses tell me that nearly 2,000 additional patients could be seen by nurses each week if full practice authority were in place here in the Commonwealth. Bartolotta's bill has broad bipartisan support in the state Senate, where it has passed previously. However, it's the House that poses a bit of a challenge going forward. We'll have many more details up on our website, WENY.com. But for now, reporting live at the Pennsylvania Capitol for WENY News, I'm Brendan Scanlon. Renata and Nick, back to you.